Hello, loveys. Happy Friday, May 23rd, 2025. And today we are tackling day 20 Commonwealth v. KarenRead and the medical testimony of one neurosurgeon, Miami's finest, if you will, Dr. Wolf. Not to be confused with Crash Daddy, Dr. Wolf. Oh, thank you so much for anyone seen Bev's Graves Concern says we're here for the mandatory staff meeting. I am so unbelievably proud of my nurses showing up 7 o'clock, 7:10 because of technology problems, but for being here because we need to talk all the shit like only we can. Am I right, ladies and gentlemen? My four gentlemen, thank you for being here. Okay. Well, listen to me. I needed to actually decompress. I had to take a moment and I had to say, what in the actual fuck happened on day 20? Right, babes? Did we all not collectively clutch our pearls and clench our butts when we see this character get on the stand? And if you are a nurse, you know that Dr. Wolf looks like every single one of our doctors that was like when you're a brand new nurse and he told you that you don't know shit about shit. Looks like he has the bedside manner of a robot. Okay. But listen, does he have experience since before I was born? Yes. Yes, he does. Is he credentialed to the hilt? Absolutely. Is he still doing day surgeries down in Miami at Larkin Health Systems? Yes, he is. Okay. He's getting people in and out 3 to 5 a day and also having time to make Mrs. Wolf her cappuccinos at 6 a.m. Oh, I must give respect where respect is due. But now that that's out of the way, we also have some things that we need to address, lovies. Because if you are not in the medical field and you're seeing Dr. Wolf up there, you're thinking to yourself, wow, this is a very credible physician, which of course he is. But as a neurosurgeon, you are not a forensic pathologist. You are not board certified in performing post-mortem autopsies. And although he did have 6 months of training, that is not a drop in the bucket compared to who? Irene Scordi-Bello, our queen, our doctor, who has testified in trial 2, or Dr. Renee Stonebridge, who I am praying, lovies, is going to be on the defense list. I want you to call her because she has all the answers that are needed. Tonight's stream, babes, is going to be medical heavy. So if this is yuck for you and you don't like it or you don't want to hear about radiating basal skull fractures, I totally understand. I love your face and I'll see you another time. But if this is your jam and if you want to see what I believe Mr. Robert Alessi did, we're going to be very excited. Very excited, in my opinion. Hi, Paulette. Thanks for being here. And I saw Jen Altman's in the chat. That's fun. And this is absolutely her jam. Listen, she'd be here if it was anything gross. She'd be like, absolutely, tell me everything. She wants to know all the deets. And so, because I'm a nurse and not a neurosurgeon, I'm going to do what nurses do best: compare and contrast our providers. Oh, he said this. Well, guess what? I got 2 other incredibly talented queens that may have said something opposite of what Dr. Wolf did. And additionally, we're going to go through the definitions that, although convincingly told, may or may not be incorrect in nature. So, without further ado, Queen Olive is here. She is ready to rock and roll. Let's let Hanky take the spanky and give it up for Dr. Wolf. Bow, bow, bow.
Commonwealth calls Dr. Wolf.
Woo!
To the court and jury in the case now and hearing to the truth, the whole truth, nothing but the truth, so help you God. I do. Thank you.
Oh, he does, Jim. Oh,
Good morning,
he
Doctor.
does.
Good morning.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name and last name for the court reporter?
Sure. My first name is Isaac, A-I-Z-I-K. It's phonetic. Last name is Wolf, W-O-L-F, like the real thing.
What do you do for a living?
I'm a brain surgeon.
Isaac, phonetic, okay? Wolf, like the real thing. Oh, out the gate. I was into it immediately.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is brain tumors and trigeminal neuralgia. But I also specialize in movement disorders. I do pediatrics and adults.
Are you an
Thank you.
active working neurosurgeon?
I am very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work, 5 days a week. I take call 300 days out of 365 days a year.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much percent of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
Well, why I kept this in specifically, babes, was because he does not do this for a living. He is not a consultant and he doesn't do, trials or testimony. He doesn't typically testify as an expert witness. And very interestingly, when the World Wide Web is available, we know things, we can find them, right? Just www.fuckingfindit.com. And I did. So I found that Dr. Isaac Wolf has been called as an expert in 3 trials in his career. And can you guys guess how many were challenged? How many of those 3 were challenged by the opposing counsel? It didn't tell me which side, but they tried to have Daubert Lanigan hearings to prevent him from testifying. Oh.
I want you to take us through some of your education and background. Could you share with us where you went to medical school and where you graduated from?
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Oh my gosh, not that, Dina. I'm literally, we just started. I'm going to get emotional. 20 non-consensual Nurse Kim memberships have been gifted to the 20 of you who did not request this. I apologize. Check it out back there. See if you like it. And not that, Dina. I love your face. Thank you.
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the number 1 training centers for chairmen in neurosurgery at the time.
Did you, in your residency and in your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center as a chief resident, through a VA hospital, and then ultimately the university hospital for elective cases. We also do 6 months of pediatric neurosurgical residency.
Did you
Well, thank you. Thank you, Dr. Wolf, for all of your training and that 6 months that you got back in the 80s for your autopsies of brains and your neurological? Thank you. Thank you.
do a fellowship at New York University?
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions.
Well, and let's be perfectly clear. Parkinson's, there hasn't been a cure for. And unfortunately, Michael J. Fox and other celebrities would let you know that they wish that they could go back to the future and have had their Parkinson's cured. Thank you.
Positions, and so you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually two separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in, could take 15 minutes, could take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma, and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s. When I got there, we were transitioning from a very small center to a 125-bed hospital that was completely committed to trauma.
Okay. And Levies, just for a compare and contrast, the new BMC South, formerly known as Good Samaritan Hospital, is a 225-bed level 1 trauma hospital. Okay.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a year, a month, basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice in Miami, and I started the Miami Neuroscience Center. We were the first private community hospital to have what's called the Gamma Knife. So we were the 13th in the country, but the only one that was non-university based. And Gamma Knife radiosurgery is using radiation to operate on the brain.
Are you presently?
Levies, the Gamma Knife was actually a really big deal. Okay. And what it is it's basically lasers. Okay. You used to they would put like a frame on your cranium, and they would adhere it and put you in an MRI tube. And from there, they would map your brain and shoot lasers at your either tumor and or trigeminal nerve endings. It was a massive leap in neurological science. Okay. Now they do the ZAP machine, which is you no longer need to have the frame. So you just go in and they're able to have even more acute positive results. So instead of doing full brain radiation, you are only doing the specific cells in which are needed and that require that treatment. And there are more positive outcomes allegedly.
The director of the Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
Do you conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, then we moved to Larkin Hospital 13 years ago. developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
Oh,
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes,
Are you a member, a fellow American of the College of Surgeons?
yes,
Are you a member of North American Skull-Based Society?
yes,
And is that brain-related?
it is.
Are you a member of the Society for Neuro-Oncology?
Yes,
Are you a member of over, or at least 34 different professional memberships?
yes,
34.
In your career, have you engaged in research?
yes,
Has that research focused or centered on brain injury?
yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue acidosis in severely head-injured patients?
Yes,
Did that research and as a principal investigator help you in your diagnosis and treatment of brain injuries?
it actually was in the treatment of severe head injuries, patients who are unconscious. The concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG SOD in severe head injury?
Yes,
Could you describe that very briefly?
basically the same. One of the biggest problems in brain injury is the fact that blood flow ceases to exist as the brain swells up. And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them.
Oh.
All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after a brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
I mean, if this isn't giving like the most sporadic, like I don't even know that this man is everywhere and nowhere at once. Is this not what it's giving to you guys? I'm not going to say that it's, like measuring penises, but it feels like Hank Brennan got up there and he's saying, look at what I found. Look at my diamond in the rough. And it does get a little rough for you, Sir Wolf.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
They are
The author
difficult
of
to
a book
manage.
chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you an author of a book chapter, Imaging of Craniocerebral Trauma?
Yes.
Were you an author of a book chapter in emergency room assessment of the head injury patient?
Yes.
Were you the author of a book chapter, Intracranial Injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I love it that Hank says, I won't get into the rest of the chapters of all 16 chapters you were involved in. Woo!
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So go ahead and ask the question without comments, please.
Were you an author of a journal article, Intracranial Pressure in Non-Traumatic Ischemia and Hypoxic Cerebral Insults?
Yes.
Oh,
Were you the author of a journal article, Post-Traumatic Cerebral Infraction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Could you tell me a little bit about that paper?
We used thin cut CT scans to identify fractures of the skull base. Prior to CT scans, it was very difficult to actually identify radiologically a skull fracture with plain X-rays. The idea was to see if we could identify more clearly. And so we classified them and delineated them in the paper and discussed the outcomes that were relative to those type of injuries.
In the last journal article I asked you about, were you the author of a journal article regarding acute traumatic midbrain hemorrhage?
Yes.
Were you the presenter in a number of presentations regarding head injury and brain injury?
Yes.
oh,
You've listed 93. I'll ask you just about a few. Were you a presenter in fractures of the clivus, clinical and radiographic features.
Yes.
Am I pronouncing that correctly?
Clivus.
Were you the presenter in acute head injury?
Yes.
And a separate presentation, fractures of the clivus, classifications and clinical features?
Yes.
Genius.
Do you lecture?
Yes.
You're lecturing me.
Do you have peer-reviewed publications?
Yes. That was one of them.
Thank you. And are you heavily involved in clinical research?
Right now, my research is more based on radiosurgical techniques and outcomes.
Over your career and your study and your clinical experience, have you treated different types of brain injuries?
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Oh,
Were you asked to review materials relative to this case?
Yes.
And do you recall the materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner.
look at this little childlike empress. Do you see him? Oh, he's hiding. Sorry, babes. There's a new feature in the studio, and I can put up the comments so that they're seen. But look at this. Look at this child. All right. He's not a child. He's the appellate lawyer for the Commonwealth, but he looks like he's 21. He still has to show his ID when he goes to buy like Broncaid over the counter because he's definitely asthmatic. You know, you can see it.
Examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy,
Oh, you're assuming.
and I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand is a clinician understands the process from the time the injury occurs till the patient either leaves the hospital or dies. And it's a process. And as a neurosurgeon, I have a tremendous amount of experience with that, if that's what you're asking me.
Yes.
No.
And so, doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to ask to display Exhibit 160.
Okay.
All right, babes, now we're getting into business. I just wanted to keep that because this is just gearing up to every answer this Dr. Wolf is going to give. He is the quintessential physician who knows everything about everything. Okay. This is a physician who is a neurosurgeon and again deserves all the flowers in the world for his neurosurgery. I mean, we won't have to get into the 1-star Yelp reviews he got 7 years ago from other physicians and bad outcomes that he's had at his practice. But I digress. He believes that he knows so much that he should be an expert witness at a trial for a fallen Boston police officer that he did not treat and that he is Monday morning quarterbacking the shit out of it. Thank you.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration.
Nope. Oops. So you're wrong there too. Okay. So we remember because we take accountability when we're incorrect. It was actually 2.5 centimeters, not 2.5 inches. So it's less than an inch. But continue, good sir.
With bridging tissue and contusions and abrasions. To us, that's just a classic blunt trauma injury.
Where was the contusion? I didn't see a contusion on the back of Officer John O'Keefe's head. saw an abrasion, a compound injury of an abrasion at the top, and a laceration right below it. That was 2.5 centimeters, AKA a little bit less than an inch.
There's nothing other than just vanilla about it. This is what happens
It's vanilla.
when soft tissue hits a solid ground. The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Serrated edges and a very vanilla injury. His words that he uses during his testimony, Loveys, is slightly jarring to most, but, you know, specific style aside, it's interesting to see because I think he has tells here.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information provided to you about the actual inside the skull of Mr. John O'Keefe?
Yes, it was the pictures that I was reviewing showed a non-depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over the orbital roofs. He had fractures along the temporal fossa as well. So it was a classic linear basilar skull fracture.
Is basal skull fracture a
It's
characterization?
basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum that connects your brainstem to your spinal cord. And then as your brainstem goes up, it goes into the different skull areas that, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
Thank you.
Can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you fall backwards, and the linear acceleration starts to take you back down with gravity. The skull hits the ground. It gets, in layman's terms, smashed a little bit. And then
And this is where I passed out. Loveys. I needed to be resuscitated. Get smashed a little bit in layman's terms. Okay, listen, I know that the jury may not be medical professionals, but smashed a little bit was a place that the eye begins to twitch on Nurse Kim, and I question, am I here? Are you here? Is this a figment of my imagination?
the brain moves forward as a response to that. And it moves forward because you have cerebral spinal fluid and because you have the deceleration, acceleration again. As it does, your skull, if you're to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones. So the brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage.
Oh.
That space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And normally, you really don't see it unless you open up the brain and you're operating. But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or, for example, the classic, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space. The other thing that occurs in trauma like this is you can get a subdural. So the dura is the membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus.
Oh.
And if those tear, you have a venous hemorrhage from, which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma. And so when you look at the pathology, the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions.
Well, we're going to have to stop you right there. So Dr. Wolf just said that the subdural and the subarachnoid hemorrhages were not huge and would not have needed or required surgery. Now, babes, that's incorrect. And why is that incorrect? Because I am going to bring to you the one, the only Dr. Renee Stonebridge. Let's first and foremost go over her qualifications and why she is the green goddess. Oh, where is it? Here it is, right here.
And doctor, are you board certified?
Yes, I am board certified in anatomic pathology, clinical pathology, forensic pathology, and neuropathology.
And if you could just explain to the jury a little bit about what does board certified mean?
Board certification means that every medical specialty has their own board. So for example, the American Board of Pathology dictates whether or not you can be board certified based on certain criteria. So you have to meet certain criteria, meaning that you have to complete a certain number of surgical specimens, a certain number of autopsies, and then once you meet that criteria, you can take an exam, which if you pass, leads to your board certification.
Well, thank you, Dr. Renee Stonebridge, and your board certifications in anatomic pathology, clinical pathology, forensic pathology, and neuropathology. Wow. Okay, let's just say that one more time. Wowza. Now, Dr. Stonebridge, could you tell me what you thought about Officer John O'Keefe's hemorrhages that you noted? Was that here it is.
Now, as far as the subarachnoid hemorrhage that you observed, where was that located within the brain, and if you could?
So the subarachnoid hemorrhage was on the frontal poles, which is essentially right here in the front of the brain. So the frontal lobes obviously sit in the front, and then the poles are the very frontmost portion of the brain. So it was on the frontal poles. It was also on the left temporal pole. So the temporal region is right here in the temporal region. And because of the way that the temporal lobe is shaped, it kind of has a little loop right in the front. So it has a pole as well. So it was on the left temporal pole. And then it was also in the left lateral fissure. So you have a frontal pole here. You have the temporal lobe right here. And then the lateral fissure goes kind of in between the temporal and the frontal lobes. So you have the hemorrhage here, and then hemorrhage right there. So it's kind of all concentrated almost in one area. But then there was also hemorrhage of the posterior surface of the right temporal as well. So on this side.
Now, doctor, I'm probably going to.
Oh. Okay, Dr. Stonebridge. Thank you so much. And loveys, when I went back and I watched her actual hands as she's saying all in this area and then right over here, she's giving us a demonstrative of where those bleeds were. Oh.
That I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back. At the beginning, you said that this laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes, I mean, like I said, it's a classic blunt trauma laceration.
Do you have an opinion to a reasonable degree of medical certainty whether this injury, the laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
My opinion is that that's what caused his whole injury.
Wow. This is when I said, oops, credibility is out of the door. Out, we're out. Doesn't matter, because that, even though that is your opinion, good sir, you shouldn't be making that opinion. Your opinion on causation is null and void in a court of law. Because you, good sir, did not treat him. You have no idea, and there are so many other options for blunt force trauma, impact injuries that were sustained here, and yet you are going 100% to one reason only? Oh, loveys, that's not how we practice medicine. We know better than that. You have to always say, well, I guess it could have happened. Yes, I believe this is probable, that this is more likely than not. But for him to put that as all of his eggs in one basket. Oh,
The pattern of the laceration, do you have an opinion whether that is consistent with hitting the cold, hard ground?
Objection, Your Honor. Could we have sidebar on that, please?
So I'm sustaining the objection, so no sidebar.
Your Honor.
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only way he could get this kind of an injury was to fall backwards, hit the back of his head, and then the resulting, energy forces going into his brain, into his base of his skull.
well, there it is. There it is, Lovey. The energy, okay? It's the energy forces, dark energy, dark forces, okay? This is the craft, and he's the bad one, apparently. All right? And let's go back, and now let's hear what the actual medical examiner, Dr. Irene Scordi-Bello, what she had to say about possible causation.
Now, Dr. Scordi-Bello, you had made reference as far as cause of death being a blunt force injury. Is that correct?
Correct.
At least one of the contributing causes. If you could explain to the jury sort of what you understand that to mean as far as what is a blunt force injury.
Blunt force injuries are caused by any blunt object. That is a very big category of objects. A microphone could be a blunt object. This bottle, if heavy enough, could be a blunt object. The ground can be a blunt object. So anything that doesn't have a sharp edge or a razor edge, not a knife, not a scalpel, is a blunt object.
Wow. That's very different than Dr. Wolf's summation that this could have only occurred with Officer John O'Keefe falling and striking his head on the frozen murder ground.
Would that type of laceration require Mr. O'Keefe to have hit a line type or ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you could look it up, would be just a classic blunt trauma injury.
Is there anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
No.
Objection, Your Honor. We again request kindly a sidebar on this.
All right, we'll come to
Thank you.
Pretty big category, loveys. And thank you, Audrey Sova. You're a doctor, every 80s trained surgeon ever. Obsessed. And thank you, Dasher and Dancer and Prancer and Blitzen. Thank you so much, Lovey, for non-consensual Nurse Kim memberships. And Kathy says, geesh, like an assembly line. I hear you, babe. And Kristen Pino says, this doctor helped the defense more than the Commonwealth. Not one medical professional says John was hit by a car. Totally agree. And how this ends, loveys, and what Mr. Alessi gets out of him, woohoo, chef's kiss. Lady Zelda says, congratulations on 20K. Oh, put me away. Stop it, Lady Zelda. Thank you so much. I appreciate you. I can't believe it, loveys. Whew, who does she think she is? No one. And X on top says, I've got out my 2-inch ruler and stethoscope checking for life. Oh, I know, Lovey. And Amy's positive pathways has been at Nurse Kim's house for 8 months. I love you, Amy. I can't believe you've been here that long. I'm sorry. And hello and happy Friday night to you. And on top, XX says, me and Blair are having 10K pay-per-view fight over her. I will pay to watch you fight for the Green Goddess. And Hank Brendan's floating timeline is the best that I have seen. It was a haymaker by a right-handed person applied to the left side of John's head. Whoops. Oops. Clutch those pearls, Lovey, because we know that something happened that was not only hitting the back of Officer John O'Keefe's head on a murder round.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards.
Is
there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen, in your experience, similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on the forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota. It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center in Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the.
Well, wait a minute, Levies. That's actually big doings, right? Many times we have seen drunk people fall. But do you know the interesting thing that we note in all of Dr. Wolf's testimony is nothing about being struck by a vehicle. Thus far, I mean, we are in it. We are in the thick of it. And you are describing someone falling down drunk. Oh.
The temporal area, and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
Absolutely. Ooh, woohoo. Okay. Well, let's go back and see what our other Commonwealth ladies had to say. And interesting that Hank Brennan would bring a neurosurgeon who contradicts the findings of neuropathologist, the director of neuropathologist and cardiac at the Office of Chief Medical Examiner, and Dr. Irene Scordi-Bello. Let's see what she had to say about skulls being pretty thick.
Now, Doctor, with respect to the head injury, specifically the fracture, what, if any, opinion can you give or can you say in regard to the type of force or amount of force necessary to cause the fracture of the skull that you observed with regard to Ms. O'Keefe?
I can't really give you a number. I'm not a physicist. I can tell you that the skull is a pretty thick bone. It takes considerable amount of force to fracture the skull. So that was a pretty considerable impact.
Now.
Oh, okay. Now, Levies, if we do look up from the CDC or NIH, you will know that there are deaths per year in the United States of America that result in a fall, just a fall, ground level. But these usually occur in whom? What population? The elderly. Okay. And it is elderly patients that have other comorbidities. And we know that Officer John O'Keefe was in his mid-40s and that he didn't have other comorbidities that one would expect, or a finding that would result in death from a fall. Can you imagine, Loveys? I want you to literally put yourself in this position and say, if every time an adult human being, a healthy adult, fell on ice in the Northeast, in the Midwest, anywhere, and died secondary to that said injury in the winter, we would not be a populated country. This is nonsensical what the Commonwealth is trying to present via Dr. Wolf.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple of detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
Well, the medical term is a coup contre coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped. And it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result?
Well, wait a second. Okay. Now, loveys, I'm going to pull up for us the actual findings of Officer John O'Keefe's skull. Okay. So right in front of you, this is Officer O'Keefe's skull without his brain is, this is a diagram that shows you his brain is out, and this is the inside of his skull. We know that he has that laceration to his right occiput, and that if this was a coup counter coup injury that Dr. Wolf is stating that it is, you would have force in motion that would go an equal and opposite reaction. Okay. So you have a right occipital impact, then it would go above his left side, above his orbital arch, and then come back, right? You would have that reverberation. But what is this? What is all of this, loveys? You don't have that in a typical presentation. And I'll show you this is what it means to be a coup counter coup injury, right? Here's your impact. Boom. We have impact to our brain. Hope this visual helps, right? Then you have your brain goes, I'm jiggling, right? Boom. Hitting because we have very limited space in our brain for movement, right? It's encapsulated. And then you have that injury that would be a contra coup right there. So you see impact, contra coup up here. So now let's go back to the diagram of Officer John O'Keefe's skull fractures and tell me with a straight fucking face that this occurred from one man falling at 6'2" down to the ground, like not from 3 stories, just from standing to falling. This is what Dr. Wolf wants us to believe. These are all radiating fractures. Radiate. Okay? And so this line would make sense. All of this has to be unaccounted for in Dr. Wolf's findings, right? And then we know that his pons, and he ended up having his unsi collapsed, and they herniated down through his brainstem. And it was so catastrophic that, in my opinion, Officer John O'Keefe wouldn't have ever regained any quality of life had he been able to be kept alive on some sort of a life-sustaining measures, on life support. He would have never regained any function because of this catastrophic injury and traumatic brain injuries. Okay, Bubbles.
Result of the process coup counter coup.
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that would more likely than not have caused a depressed skull fracture.
This is where I got angry because that's not accurate. Okay? Not accurate. That is 100% inaccurate. This is not a stabbing. This is not a bullet. There should be no depressed fractures, but a bat 100% could leave a intact, right? It would be blunt force trauma to the skull, but we're not having a penetrating TBI, Lovey. So it was going to be like that you are still, it's a closed system and there is no cracks or breaks that are through the skull that would be depressed, if that makes sense. So you could absolutely, if you have blunt force trauma to the skull, it could come from a motor vehicle accident, but not the way that we're thinking, not a pedestrian strike in that manner. I'm talking of like hitting a driving, the wheel, hitting the dashboard, hitting a window, the windshield. You can have blunt force trauma impact injuries. Falls, absolutely. If you have sports injuries, if you're playing a contact sport, football, if you're playing hockey, if you are struck by an object, like a blow to the head with a baseball bat or any object, you do not have to have a depressed skull fracture. That is wild to say it. And also, you would find blunt force impact injuries to someone who was assaulted, domestic violence, even fists, blunt force trauma by a chair to the head. There are so many different things that could produce that outcome, that this was wild to me that he stated it on the stand.
Blunt trauma, the way he had, the assumption, would cause the coup counter coup without a depressed skull fracture.
When the coup counter coup process happens with the skull fracture, does anything happen to the front of the skull?
Well, you're asking me, does the rest, the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You can have fractures along the orbital roof. The orbital roof is very thin. And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had both the ME and the pictures taken, and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a
Orbital
reasonable degree of
floor,
medical certainty
okay.
how those fractures occur?
From the trauma.
Could you just explain a little bit how that would happen?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity.
Oh, clearly, babes, clearly. It was a very high speed generated by the gravity. Oh, Trooper Paul, are you cosplaying as Dracula? What are we doing right now? You, sir, are not an accident reconstructionist. You're not a physicist. You are not a biomechanical engineer. So when you're saying the dark forces, the energies, the 88 gigawatts that it took was propelled by gravity. Wow.
The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roots lay. And this is why people like this get what they call raccoon's eyes.
Raccoon.
Do you have an opinion whether the brain itself could have caused the orbital fractures?
No.
No.
The brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. The brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus, that middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
Quick question. Who said, now let's act like an owl. Who said that the brain caused the orbital fractures? Or was this just Hank freeballing it? Was he throwing us a little, hey, could this have happened? You know, because we know he doesn't do his summer reading. But who, if anyone, said that Officer John O'Keefe's brain caused his fractures in his skull? Thank you.
In your study of the records and photographs and in your experience treating these types of injuries, do you have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Well, it's impossible to know whether he became immediately unconscious, but his injuries were very substantial, and it's more probable than not that at some point he quickly became unconscious.
Well, wait a minute. Dracula, quick question. Was it not substantial because he didn't need surgery and everything was fine and he could have been saved? Or was it that he had very substantial injuries and likely would have...
And was unable to do functional activities.
What does functional activities mean?
The ability to, get himself up and about would be one of the functional activities.
Good old functional activities.
The ability to call for help would be a very significant cortical function. And that's why I was talking about, that there's a variation on a theme from a simple concussion to a severe concussion like this.
If a person...
Did you just say that Officer John O'Keefe had a concussion? Oh, Dr. Wolf. Let's go and hear what Dr. Renee Stonebridge described when she's talking about what happened to Officer John O'Keefe's brain. That is number...
temporal lobes. So the brain is essentially oriented in a way that each hemisphere, the right and left hemisphere, are the same. The unsi are the most inner portion of the temporal lobes. So the unsi sit just next to the brainstem. So if you have anything that causes herniation of these unsi, they start to push inwards onto the brainstem. So say this is the brainstem, here the unsi, they start to push in. And because the brain is within the skull is hard, you have no room for any sort of expansion of the brain. If there is herniation, it will start to push in that area because the brainstem turns into the spinal cord and goes out of the skull through the foramen magnum. So you have this hole about this big or so at the base of the skull where the brainstem turns to the spinal cord, then comes out. So that's one of the only areas in which the brain can actually move because it's encased in the hard skull. So if you have herniation, it'll start to push and then push downwards.
Could I ask you to spell on side?
Oh, okay. I'm going to say with a medical degree of certainty here that he wasn't concussed, good sir.
Person does not have functional abilities because they are rendered unconscious. Does their body, could it still move?
Yes, this is the interesting thing about our brain. So the cortex, which is the top portion of your brain, can get separated from your brainstem functionally. And what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious, as an animal came up to eat it, the animal would touch it. Well, you have these automatic movements. One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then
Jesus
a
Christ.
worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal.
What? Didn't know we were going to go back into caveman times. Okay. I would also like to discuss with you later, sir, the Big Bang Theory and Newton's law of physics. Thank you.
So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not thought processes. In other words, your brain is not telling you, oh, you have pain, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
I want you to
So, okay, so it's a pain response, and yet he's saying this because it's warding off animals. Now, I don't know if that was like a random Freudian sort of connection here. Was this something that Hank had discussed about potentially Chloe? Because why, oh, why would we talk about caveman times and be discussing that if you're decerebrate versus decorticate, what movements that are autonomic, which are happening automatically, not that one's thought process conveys it, why he would ever say this? Oh.
take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you share?
I don't. Yes, I'll tell you. There is very few things that you head injury where you would die, quote, immediately.
Loveys, just a little bit of a trigger warning. This is wild 10 seconds.
So if I took a knife and stabbed you in the back of your neck right below your skull and I drove it through your brainstem, you would probably die immediately. If I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately.
Oh.
But traumatic head injuries, you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a while to develop. Decreased blood flow to your brain because you're getting swelling. And ultimately, death of the brainstem that controls your heart and your breathing. And so this is why there's a whole big issue about brain death. You know, when is someone brain dead? Because it's not instant and it can take a long time to be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%.
Okay. So again, we have contradictory information from this physician. He is telling us that in linear skull fractures, which is exactly what is noted, a radiating basal skull fracture that is linear, clearly, Loveys. We see it in the picture, right? Let's go back. Sorry, I'm being like a geek tonight, but you see the line clear as day, okay? And then radiating all over. 67% of his patients they ended up expiring over this.
But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical examiner took pictures of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space. Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would
Nope. Hours to minutes is the, minutes to hours rather, loveys. That is the actual time frame that it can take, but not 48 hours. That is incorrect, patently incorrect.
would make it not immediate.
Could we please have Exhibit 14? Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue that sort of configures.
Ecchymosis is what we call it in medical terms.
If he had his eyes open, like what we describe as raccoon's eyes, right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside with leakage of blood products into that periorbital area.
You mentioned that starts or takes at least 1 to 3 hours to begin.
Minimally, yes.
You take that down, please. If Mr. O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field.
Oh, he already was in the field.
One of the
Thank
first
you.
things you need to do in a head injury is control the airway. Why? 2 reasons. 1, you want to have enough oxygen going to the brain to feed it. And 2, you want
Just an FYI, loveys, he 100% was intubated, but thank you, sir. Thank you. I don't know if the light affects your eyes, good sir, when they turn them back on.
to keep the carbon dioxide down because that causes increased intracranial pressure if it elevates. So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something
Oh, hello.
or not.
Oh,
During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying the brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case-by-case, production of blossoming is occurring.
blossoming.
You mentioned that
It's referring to a bloomin' onion and cavemen. Wow, you've really outdone yourself, Hank.
2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of their brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head until his ultimate passing?
Well, hypothermia, if you define hypothermia, it starts at 95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems.
Sorry, Audrey. I made a joke. It wasn't funny. I apologize. I do know that we use Blossom and Bloom for edema. I'm sorry. But thank you, Lovey.
It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die.
So if Officer John O'Keefe was at 80 degrees when he was brought to Good Samaritan Hospital and when they took his core temperature, what are we saying, sir? I'm confused. Which one is it? Could he have been saved, or was this fatal and he would have expired no matter what intervention had occurred? Now, riddle me this as well, loveys. If, in fact, life-sustaining measures could have saved and provided a different outcome for Officer John O'Keefe, then there are more than KarenRead that would have been eligible for saving his life, i.e., the 9 people that walked out of the front door of 34 Fairview, walked down the walkway a mere 30 feet from Officer John O'Keefe, illuminated by a thin layer of white snow falling. And even with Matthew McCabe, for example, who walked to his car while the girls were thinking about making peanut butter sandwiches. And because he forgot something, he went back into that house and walked out a second time. If this is an alleged minutes that made the difference and that could have saved Officer John O'Keefe's life, then there are other people that should have been responsible for not acting to save him.
So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience for people that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
Okay, and now let's go to Dr. Scordi-Bello discussing that similar question and what she believed. It is the 32nd.
Becomes hypothermic and then falls as a result. But the hypothermia would continue along with the brain injuries that took some time to develop. So in my opinion, I believe the impact, the injury to the head came first. Mr. O'Keefe was most likely incapacitated or unable to move into a warmer environment, and then the hypothermia set in.
Okay, so now listen. I found that clip from her testimony in the first trial, and that is imperative, loveys, because when she is discussing that the hypothermic findings would have continued, she would have continued to see what? Those gastric hemorrhaging, those tiny, small Wanushki's hemorrhages that were found. There would have been more. And when you have someone who truly has passed away from hypothermia, it would have been present in over 50% of Officer John O'Keefe's gastric lining. We know that it was only present in 10 to 15%. So, therefore, ergo, Officer John O'Keefe received that fatal blow in whatever way shape or form it occurred. And the hypothermia was clearly secondary to a point which I believe that Dr. Scordi-Bello saying that in trial 1 indicates that if Officer John O'Keefe had was struck, right? And the hypothermia, if it was happening at the same time, concurrently, then we would have seen more findings of hypothermia versus him being hypothermic. Officer John O'Keefe had no signs of frostbite per the medical examiner. How do you have no signs of frostbite being out in 20 degrees in a wind chill that was upper teens for 5.5 hours? If we go by the forensic evidence of the cell phone battery that Hank Brennan mentioned throughout his opening statement, we know that there is a 4.5-hour window that Officer John O'Keefe's phone battery does not get colder. It was not in his North Face thermal coat. His cell phone was found between his mid back and his scapula, between his shoulders. It wasn't in his pocket. He wasn't dressed appropriately. He had no frostbite on his nose, on the tips of his ears, on the tips of his fingers. Nothing. I believe that the hypothermia and his body losing the temperature the way that it did, and to the degree in which it did, wouldn't have taken more than 2.5 hours, if I could do an estimate. Knowing that he is pliable, movable, his extremities, he is not rigid. He was a viable candidate for resuscitative efforts. He showed no signs of lividity, loveys, no pooling to his back, indicating that blood had begun to settle. I'm telling you, that is huge. Even though Dr. Scordi-Bello, she rationalized it saying, oh, well, he wasn't able to get somewhere warm. I think of it as he was brought from somewhere warm. What do you think? Tell me everything.
I'd ask you questions about whether you had an opinion about Mr. O'Keefe and when he died. I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any clinical experience I have.
Dr. Wolf, thank you.
I also do not believe that.
All right.
He died
Let me have
immediately.
a moment, Your Honor. Thank you.
Oh, you dummy. Oh, I'm sorry, loveys. Hold on. I'll get us back there. We know exactly where we are. Oh, you foolish, foolish woman.
Well, none of the patients we treated died within.
Okay, now this is what I wanted to say. This was a cross that I was waiting for. I said, oh my gosh, Robert Alessi is going to get up and he is going to absolutely Alessiate him, right? But there is a method to the madness, and we'll go over what we think. But Dr. Wolf was not able to provide other insights in which I believe Hank Brennan wanted him to get into. So every layer that Mr. Alessi opened up would have been able to have a rebuttal. And all he needed out of Dr. Wolf was that you are not a qualified forensic pathologist. You are not you are not a neuropathologist. You are not board certified to conduct autopsies or have an opinion. You work on live patients, and that is it. Period. Full stop.
May I, Your Honor?
Yes.
Morning, doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
Oh,
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make a cappuccino for my wife at 6 o'clock in the morning. And then I get back to work at 6:30 and move on. I have patients that I'm operating on.
I'm going to tell you this. I liked that. I love a man that's making a cappuccino for his wife at 6 a.m. And even Mr. Alessi was like, that was cute.
And I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I mean, I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
So none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist.
You could have asked that question, very straightforward. I am not a forensic pathologist.
Oh, I'm sorry. You know, here's just another thing that Dr. Wolf would like to put directly on his CV. One of his clubs is, I'm also a fucking attorney. Okay? So I'm going to tell you how to ask me questions. I can't, loveys. I cannot.
I'm a brain surgeon.
Right.
Yeah.
And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Oh, anything you can do, I can do better. I can do anything better than you.
Right. And is it correct to say that the brains that you see are
He totally loved himself on that one. He was feeling it. You see? He was like, got him. I got him.
of living people?
Living.
Correct.
Okay. So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the decedent.
Excuse me, I didn't hear the last word.
I'm sorry, with the topic is going to be Mr. O'Keefe, the decedent in this matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
Oh.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Are you aware that
Hi, Dr. Kerry.
Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolf,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor.
Okay, go right ahead.
Thank you.
In his natural habitat.
Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid?
That's possible, yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with
it.
Correct.
Oh, and that was it, loveys. He just said it. So if everything happened and Officer John O'Keefe fell on said murder ground, received that blunt force trauma impact that caused such catastrophic brain damage that his unsi began to swell and travel towards the pons into the brainstem and herniate his brainstem. Where did the laceration and blunt force come to his face? Right above his eyebrow. Oh?
I have one more moment, Your Honor. Thank you. Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Okay, any brief follow-up on that?
No, thank you.
All right, Dr. Wolf, you're all set, so you guys have your-
Well, I'll be dipped, loveys. We didn't see it coming. It was the shortest cross of an expert that we could have ever imagined. But like I said, I believe that Mr. Alessi got what he needed to get out of Dr. Wolf, which is I am not a trained, anatomic pathologist. That is not my job description. And that he had another injury to the front of his face that is not going to be able to be explained via accident reconstruction, and that did not occur via him landing on the back of his head on the lawn of 34 Fairview. When you have a witness like Dr. Wolf, I think that Mr. Alessi was living on a prayer, thinking to himself, if I give him an inch, he is going to take a mile. And what we can't do is put that genie back in the bottle. What the anti-free KarenRead human said was, oh, we got them. We had a brain surgeon who is, potentially 4,000 years old from Transylvania. And he is going to win the case for the Commonwealth. But as I believe that I have depicted pretty damn well, is we have two rock star girls from the Office of Chief Medical Examiner that say, and no, Scott, That's not actually what happened. All right? And they're like, "Listen, turtle," right? They're saying that is not what any of us said. We are not able to tell you what the centrifugal force or what what it is going to take physics wise, because we're not biomechanical engineers. But we have a neurosurgeon from Miami, bitch, said the Commonwealth. And they said he knows it all. In the 3 trials that he has ever been an expert, I only wished that was the one question that I would have absolutely loved Mr. Alessi to ask him. Sir, since this is less than 1% of your work and what you do, how did you hear about this case? Or did you reach out? I know that you're so busy doing your day surgeries, your laser day surgeries. And, some of them are 15 minutes, some of them could be up to an hour long. He has been doing wonderful work in his outpatient clinic. The Larkin Health Systems has a 2.5-star rating in Florida. Oh. But, thanks for coming. You're a real gem. Okay. And then we did that one. And the last thing, Levies, I just wanted to show you. This is from Dr. Irene Scordi-Bello. And she is talking, it was in trial 1, about how she ended up keeping the designation for manner of death as undetermined, even after her conversations with one Mass State Police trooper.
Specifically who it was that you spoke with from the state police?
Yes, I documented that I spoke with Trooper Proctor, I believe, twice.
And with reference, not asking you anything as far as what that conversation consisted of, but as far as the tone of that conversation, did you feel pressured or coerced to come up with a certain determination?
No, I did not.
And even if you had been, what would your response have been in reference to that?
My response was that I am responsible for what goes on the death certificate, and unless I have enough information, clear and convincing evidence, I cannot determine a manner.
And I'll leave you with that, babes. Dr. Irene Scordi-Bello did not have clear and convincing evidence provided to her by Mass State Police and Trooper Michael Proctor. Even after multiple attempts, she outreached them and said, "Hey, babes, do you have any more info?" This was between January 30th or January 31st when she did the autopsy. And she didn't file the death certificate until April of 2022. And Dr. Scordi-Bello still tells us, "I didn't have enough." But Dr. Wolf, neurosurgeon from fucking Miami, was able to look at some photos and let us all know that Officer John O'Keefe clearly hit his head on the ground. Had to be. Oh. Do with that what you will, loveys, but I'll tell you this. I trust the girls. And I pray and dream of the day that the defense will call Dr. Renee Stonebridge. I don't know if they will, but I think it would behoove them to absolutely bring our green goddess back to the business. Put her up and let her tell the story that has always been the truth. Officer John O'Keefe's autopsy is not KarenRead's defense. It is not the Commonwealth's prosecution. It is the truth. And it has always been the truth. So that was Nurse Kim nursing school tonight. Do we feel as though we learned anything? No? Yeah? Maybe? Keep a day job, Kim? I know. And what was this? What did I put here? Oh, I did a coup contra coup injury. Just showing us from online. Yeah, I don't even know. That was a weird thing for me to do. All right, lovies, let me just see if who are little humans that said hello to me. And so now he's a physicist, says Aubrey. And she says, that's not how force vectors work. There are more options than described by him. 110%. And that's why you are a doctor and incredible. Jenna Hags, I miss your face. Oh, this weekend I should go on TikTok, huh? All right, I'll go on TikTok this weekend. Jenna, I'm doing it. I pinky swear. I'm sorry. And I changed my name to Cora too, says, I waited all week for this. Thank you. Oh, I love that picture too. That is the best. Oh, let's put a Chloe up just because, well, formerly known as Chloe. Lovey. Look at her, babe. Look at her. She's driving. Well, maybe she wants to be in a bikini. We're having summer thought. Oh, no. Oh, there she is. Oh, I'm sorry. I think that Dr. Wolf would try to one-up her too. Okay. Just saying, Dr. Wolf knows everything. Wow. Okay, get out of there, Kim. And then we have Stephanie Cleffer. Thank you so much, Levy, for my super sticker. And Piney Woods Law and Crime says, Dear Nurse Kim and chat, sorry so few super chats lately. Buying a new house and trying to be frugal. However, I love your show and we've got Karen Reads to free. Okay, first and foremost, Piney Woods Law and Crime, buying a new house. Congrats. Mazel, my love. Don't tell me where it is, but if you do have a housewarming party, I'll send you something because we do have Karen Reads to free. Okay. And I know for a fact that Meatball Morrissey Sketty Stain makes charcuterie boards. They're incredible. I would like a crab bottle opener. Just thinking out loud. All right. I am so proud. Thank you so much for being here. And Carlina Kellogg says, you're amazing, Kim. Thank you. Stop it. Oh my gosh. No, I'm not. I'm just Kim. But thank you for being here with me. You're amazing. And Stephanie Cleffer says, Bev and Brennan with their hand signals remind me of Tom Hanks in A League of Their Own. Bunch of con artists. Okay. First and foremost, A League of Their Own, incredible film. Madonna, Gina Davis. You can't tell me shit. I might go watch that movie. If it is available on Netflix, I'm putting it on as soon as we get off of this. But fuck hand signals. And also, Bev, you know better. Be smart and pretty. Go see Teresa. And the turtle you know says, Alicia is an absolute beast. Can you please refer to me as the turtle you know? Oh, Kim, you're the best. The turtle you know. Oh, absolutely. Anything for you, Lovey. And Audrey says, thank you so much again, says the surface area on the occiput involved in the impact could easily be the same as impacted by a bat as any hard ground. Agreed, Aubrey. I don't even know. Did I read that like I was dyslexic? Oh my gosh. I'm sorry. My eyeball is twitching. The surface area on the occiput involved in the impact could easily be the same as impacted a bat as any hard ground. Yes. And I've said that for Evs, right? If this is going to be what is making contact with said murder ground, right? It never made sense that there was only an inch, or I thought it was 2 inches, but an inch opened up because there was nothing that was sharp. It was blunt impact. So the blunt impact, if evenly distributed when one falls upon it, should have opened up more than just that right occiput and that one linear straight line of a laceration, in my opinion. And heir apparent says, what he said works fine for the defense, though. Touche. Touche. Keep talking about a drunk guy falling, babes, and we're going to be cooking with gas, figuratively and metaphorically, you know? And then Meatball Morsi Scatty Stain says, I'm just proud of Hanky not asking this doc if there was a stiff placed in an ice box after getting whacked. Put him in the freezer. What are we talking about? Has everyone collectively just, when we hear Hank Brennan speak, we go, oh, and you're like thinking about starting a number 2 pencil fund for someone? There's a Jimmy fund. There should be a Kimmy fund. And then we need to get a number 2 pencil fund for Hanky. Hank Francis, first of his name, Brennan. Oh, he's losing bad. And then Melissa says, congrats on 20K. Oh my gosh, stop it, Melissa. I know, right? I don't know who I think I am. I don't really think I'm anyone, but I can't believe that more than 4 people say hello to me every day. I love all of you. Legit, love your face. And then we have Audrey says, Kim, you know we use the blossom or bloom for edema, contusions, and microscopic hemorrhage of anywhere. Yes, I do. I apologize. That was an ill-fitting joke, similar to Hank's petty paralegal who wears ill-fitting pencil skirts. Romy, love a Romy with cheese, said, I don't care what anyone says. That man is Victor Kirakakis. I don't even know who that is. Victor Caracas. I don't know, but I'm sure that you will tell me later. Sorry, Lovey. And then we have the Blossom joke was funny. Sorry, keep it. Oh, thank you, Audrey. And then we have Dr. Kerry says, Alisi with his cute hand on his chin for the cappuccino comment, be still my heart. Oh my gosh, I lost it. That was cute. Like, listen, I'll give him that. You know what I mean? Dracula is kind to his bride. It is what it is. He felt more comfortable in the dark and, you know, he loves lasers. So listen, God bless him. And then Couch Juror says 4,000 years old from Transylvania. Sorry. This was a serious stream too. I probably taught nothing here. Love you, Lovey from Texas. Thank you so much, Couch Juror. And Jules Cupcakes free Professor Karen says, love you, stay beautiful. Oh, thank you so much. Stop, guys. I'm gonna who is she? Meatball Morrissey Sketty Stain says, serious question. If the anti-free KarenRead people cross your mind, does anyone else think of the goblins from the labyrinth? And KP is Jareth, the goblin king, little dim, very sloppy, etc. No, it doesn't cross my mind at all. It's more of a little shop of horrors, right? Okay, it feels like they're all the plants just snapping. And babes, they're coming for me. I am on the list of people they hate currently. I think it's because I went on Court TV a couple of times and now they are like, they just want to say everything to me, and that's okay. So I just hit them back with facts. I go, fact. And then they're like, you dumbass, dumb fucking bitch. And I'm like, oh, do you kiss your mother with that mouth? And then I think that maybe like BDO would say from the Spaces, he would say, your mother dances on a pole for cutlets. And a couple of their mothers do. And thank you so much, Curious Law Tuber, gifting 5 Nurse Kim non-consensual memberships that no one asked for. And they're probably going to say, Kim, take it back. Take it back. No takesies backsies. Okay. You have to live through it, loveys. And you're going to like it or you're going to hate it. That's all there is to it. And B Crumbs gifted 10 Nurse Kim memberships. It's getting hot in here. What is this? Is freaking David Yannetti and a bowl of spaghetti coming? I think so. Woo! And Yvette says, love me some Nurse Kim. Fashionably late to the party, but Dracula, I love you, hon. I was reading the comments. It happened. And now it has to stick, right, loves? There's no way we can't take it back. He is Dracula now. He is from Transylvania. And he may or may not bring his wife cappuccino that has a tinge of type A within it. I said it. Stop. Okay. And then we have Fluorescent has been a member for 1 month consensually at Nurse Kim's house. Thank you for everything, Nurse Kim. Love your face. I love your face right back. You are the best. Robin G is a member for 5 months. And Robin G, I think about you every single time I go into another chat, because if I see your name, what I do is click on all messages, not top messages, so that I can see what the chat is saying, because that's the most fun ever. Being in the chats and seeing all the things. When I figured out you could do that a couple months ago, Lovey's changed my life. Now I'm watching all the chats. I got to see, what are the people saying? I love it. It's dangerous. It's provocative for sure. And Leanne Doolin says, oh, $20 for your 20K. Congrats. Thank you. Thank you so much, Leanne. I appreciate you. And we have, let's do it again. Nope. Let's do the timeline again. Says, I got Robert Blake. Oh, that's a lot. And I love it. And Random Girl has been a member at Nurse Kim's house for 7 months. Yes, but I like it when you get spicy with the trolls. Oh, well, that's a way to end it. What we do is we slay those trolls. We also have Karen reads to free. Big picture, babes. All right. Let them talk all the shit they want. And we remind ourselves that we have faith, we have truth, and we have justice that we are seeking for both Officer John O'Keefe and KarenRead. I am going to do Spaces Loveys at 9:30 with one of my best friends from out of town, Larry Legend. If you're available, jump on the Twitter. We'll slay some trolls together and have a couple of laughs. I love your faces. Thank you for joining me on a Friday night, and I wish you guys a safe and happy Memorial Day weekend. I'll talk to you soon, babes. Bye.